It's a popular show among teens that covers some heavy topics, from suicide to sexual assault. The second season of 13 Reasons Why launched on Netflix today, bringing mental health into the spotlight. Experts are reminding viewers, though the characters and their stories are fictional, the issues are real. Now, throughout this story, the number for the Toronto Distress Center will be displayed at the bottom of the screen for anyone who may need it.
And there's all kinds of debate. Is it good? Is it bad? So people come in and talk about it, or maybe it prompted them to come for help. So I think that's a good thing. But some people are a little uncomfortable because maybe they portrayed the stuff a little bit too dramatically or romantically or incorrectly, like a solution to problems.
Settle in, because I'm about to tell you the story of my life. More specifically, why my life ended.
Her name is Hannah, and in 13 Reasons Why, her character dies by suicide. The show, now in its second season, touches on mental health and suicide, stories mostly told from the perspective of high school students. It has been criticized in the past for oversimplifying the issues.
It is a difficult medium, a visual medium, to depict mental illness because of the challenge where there is usually not anything to be seen overtly on the outside.
Psychiatrists from both St. Joseph's Health Centre and St. Michael's Hospital held a panel discussion about the show and the impacts it's had, saying it has led to more people speaking out about mental health and also more people seeking help.
We've had an unprecedented number of people reach out for assistance, families, teens, youth, and that's a positive.
However, experts say it doesn't portray the entire scope of the issue. Though more people are asking for assistance, they aren't doing it immediately. Dr. Jose Silvera is saying the majority suffer silently and don't seek help until they end up in the emergency department.
For those of us in general hospitals and hospitals that have emergency departments particularly, the numbers have been quite striking over the past few years in terms of increase. Now, there has been a trajectory of increase in the number of, unfortunately, the number of deaths by suicide in youth. As it stands right now, our system is not as good as it could be in terms of its accessibility and the capacity to respond to the demands.
The doctors say there needs to be more conversations around mental health that especially touch on the importance of early intervention and treatment.
Don't be scared to ask about suicide or talk about it, because it actually increases the likelihood people go for help and lowers the likelihood they'll do it. The ultimate answer is that it's not sensational, help's available, and it's a health condition that you can do something about. So that's what's really been a big addition from the show into the conversation.
And with season 2 airing today this week, the Peel District School Board sent a letter home to parents advising there are resources available to students who need them. Netflix has also issued disclaimers warning viewers of the serious content and launched a website that highlights some of the issues such as suicide and bullying covered in the show.